My name is Alexandra Cruz, and I'm a senior fellow with the Center for Healthcare Strategies. I'm pleased to welcome you to this training on what Medicaid officials need to know about the Medicare Advantage Star rating system. This training is part of a Medicare Advantage Policy Basics video series developed by the Center for Healthcare Strategies with funding support from Arnold Ventures, the Commonwealth Fund, and the SCAN Foundation. The goal of the Medicare Advantage Policy Basics video series is to support Medicaid and partner agency staff as they build needed Medicare capacity. Many states are focused on improving care delivery for individuals duly eligible for Medicare and Medicaid. State Medicaid agencies focused in this area are increasingly using state contracts with dual eligible special needs plans or DSNPs to advance related goals. For state officials either actively working with DSNPs to advance integration or just beginning to consider how best to contract with DSNPs, it is essential to understand how the federal Medicare Advantage program works. So each of the training videos in this series begins by introducing foundational Medicare knowledge before reviewing some of the policy and program design opportunities that are available to states. The trainings also cover why particular features of the Medicare Advantage program matter to state Medicaid and partner agencies working with DSNPs. And finally, they highlight where viewers can find additional resources and supports to learn more. Now let's review what we'll cover today on the Medicare Advantage Star Rating System. We will start by reviewing the learning objectives for those engaging in this training. Then we will shift to the foundational knowledge portion of the training, which will begin with background information on DSNPs and some basic features of the Medicare Advantage Star Rating System. We will also cover the data sources and measures used in the rating system, as well as its importance to potential enrollees, health plans, and the Centers for Medicare and Medicaid Services. The Why This Matters portion of the training will then highlight the relevance of the STAR rating system to Medicaid agencies working with DSNPs to develop or refine integrated programs. We will conclude by sharing some key takeaways and highlighting where viewers can find additional resources. Through this training, you should become more familiar with 1. How the Medicare Advantage Part C and Part D rating system is used to measure the quality of health and drug services received by those enrolled. 2. How the STAR rating system may help potential enrollees compare Medicare Advantage plans and inform their enrollment decisions. 3. The quality domains and measures that are used to evaluate health plan performance in the rating system. 4. How STAR ratings affect Medicare Advantage plan quality bonus payments and a plan's ability to continue to contract with CMS. And 5, how states can use performance data from the Medicare Advantage Star rating system to understand and monitor the quality of healthcare services received by duly eligible individuals enrolled in DSNPs. We will begin by providing background on dual eligible special needs plans and the Medicare Advantage Star rating system, reviewing their purpose and some basic features. The most fundamental principle to understand about dual eligible special needs plans or DSNPs is that they are Medicare Advantage plans, and so they operate under the regulations and policies of the Medicare Advantage program. For example, like all comprehensive Medicare Advantage prescription drug plans, DSNPs provide coverage for all Medicare benefits, including prescription drugs, for people who choose to enroll. They may also offer extra supplemental benefits beyond what the Medicare program traditionally covers. The Centers for Medicare and Medicaid Services, or CMS, is responsible for administering the Medicare Advantage program, which includes contracting with private companies, commonly referred to as Medicare Advantage Organizations, or MAOs. Medicare Advantage organizations can apply to offer a wide array of Medicare Advantage plans, including D-SNPs. It's important to note that D-SNPs enroll only individuals who are duly eligible for Medicare and Medicaid, unlike non-D-SNP Medicare Advantage plans that can enroll both Medicare only and duly eligible individuals. D-SNPs are also required to have contracts with the Medicaid agency in the state where they will operate. States may use this contracting authority to add requirements to their D-SNP contracts that advance Medicare and Medicaid alignment. However, it is important to note that states are not required to contract with D-SNPs. D-SNPs must develop and implement a model of care approved by the National Committee for Quality Assurance, also known as NCQA. The model of care outlines how the D-SNP will meet the unique needs of its enrollees. Finally, D-SNPs must, at a minimum, coordinate their enrollees' Medicaid benefits. So there are a few reasons this training for state officials is focused on developing an understanding of key features of the Medicare Advantage program and D-SNPs. We focus on building states' understanding of Medicare Advantage and more specifically of D-SNPs because D-SNPs are available in nearly every state, and building knowledge in this area is essential for improving the care of the growing number of D-SNP enrollees. We focus on building state capacity because although D-SNPs must follow rules set at the federal level, it is states through their state Medicaid agency contracts with D-SNPs that have significant opportunities to improve care delivery and help advance health equity for duly eligible individuals. As CMS promulgates rules and guidance for the Medicare Advantage program, federal Medicare policy is continually evolving. So it's important for states to both understand Medicare Advantage policy basics and keep up with key changes. So what is the star rating system? The Part C and Part D star rating system was created by CMS to compare the quality of care and services received by individuals enrolled in the Medicare Advantage program. The rating system applies to Medicare Advantage or Part C health plans and prescription drug plans, which are commonly referred to as PDPs or Part D plans. Ratings are assigned for both standalone Part C and Part D plans and for comprehensive Medicare Advantage prescription drug plans, often referred to as MAPDs. For the purposes of this training, we focus on building a foundational understanding of how the rating system applies to Medicare Advantage prescription drug plans, since this includes D-SNPs as well. The 5-star system publicly assigns ratings to Medicare Advantage organizations that range from 1 to 5 stars. This includes the possible assignment of half stars for a Medicare Advantage organization's summary or overall rating. You can see this reflected in the table on the right of the screen, which displays the full range of possible summary and overall star ratings. You can also see how the assignment of both full and half-star ratings can result in greater variation in ratings across Medicare Advantage contracts. We will learn more about summary and overall ratings in the next portion of the training. The rating system includes measures that focus on an enrollee's experience receiving care, issues or processes that can impact access to care, process measures that are focused on maintaining or improving enrollee health status, and actions that are taken to improve health outcomes or quality of care. Star ratings are used by consumers and their caregivers to compare Medicare health plan options before making enrollment decisions. Additionally, the star rating system is used by CMS to determine a Medicare Advantage plan's quality bonus payment, and low star ratings, as defined by CMS, can also impact a Medicare Advantage organization's ability to continue contracting with CMS. We will learn more about how the rating system is used as we continue. To understand star ratings and their relevance to states contracting with DSNPs, it's helpful to review some basic features of how the ratings are released and assigned. As background, CMS contracts with Medicare Advantage organizations, including those that offer DSNPs on an annual basis. The plan benefit period for all new and renewing Medicare Advantage contracts begins on January 1st each year. Star ratings are released on the same annual cycle. They are released each year just before the start of the annual Medicare open enrollment period, which begins on October 15th. It's important to understand that CMS assigns star ratings to each Medicare Advantage organization at the contract level, not the plan level or the plan benefit package level. MAOs can offer multiple plans under one contract, as well as plans that operate in more than one state. As a result, the ratings for one contract often represents the collective performance of a mix of plans. This can include DSNPs, non-DSNP Medicare Advantage plans, and plans that are operating across states. However, there are a few special needs plan specific measures focused on care management and care for older adults that are reported at the individual plan level. These SNP specific measures will be highlighted in the next portion of the training. Additionally, if a state works with CMS and its contracted DSNPs to establish what are referred to as DSNP-only contracts, Medicare Advantage quality measures can be reported and star ratings can be calculated that are specific to each of a state's DSNP-only contracts. This can allow for greater transparency on outcomes and experiences specific to duly eligible individuals. This can be particularly important to both the state and state partners that are interested in understanding and improving the quality of care for those enrolled in DSNPs. States interested in learning more about this opportunity can review the DSNP-only contract requirements found at Section 422.107E in the Code of Federal Regulations, and they can contact CMS to review relevant sub-regulatory guidance. Finally, similar to other quality rating systems, the data collection and calculation processes used in the star rating system result in a lag between a Medicare Advantage organization's performance period and the year in which ratings are assigned. There is a slightly longer lag that applies specific to when a performance period will impact plan payment. The picture on the bottom of the screen is included here to help illustrate this understood lag between data collection and the impact of star ratings. Now that we understand the purpose and some of the basic features of the star rating system, we will focus on data sources and measures that are used in the system. So what data sources are used to calculate star ratings? As of 2024, star ratings derive from a maximum of 42 measures, 40 of which are unique quality and performance measures. Because 2 of the 42 measures share the same data source for both Part C and Part D plans, CMS includes only one instance of each of these measures in the calculation of the overall star rating for Medicare Advantage prescription drug plans, including DSNPs. Measures are calculated using 4 categories or sources of data, which at a high level includes health and drug plan data, enrollee survey data, data collected by CMS contractors, and CMS administrative data. Drilling down further, the specific sources of data include measures that are part of the Healthcare Effectiveness Data and Information Set, measures derived from the Medicare Health Outcome Survey, and measures derived from the administration of the Consumer Assessment of Healthcare Providers and Systems. There are other important sources of data used, including administrative and pharmaceutical data that we will highlight in a moment. Before we shift to reviewing the star rating domains and measures, let's define some of these data sources further. The Consumer Assessment of Healthcare Providers and Systems survey, commonly referred to as CAHPS, is an annual survey that asks a sample of enrollees in each plan about their experiences with and ratings of their healthcare plan and providers. This survey directly asks consumers and patients about aspects of care that they have identified as most important and that they are suited to answer. The Healthcare Effectiveness Data and Information Set, commonly referred to as HEDIS, is a set of measures developed by the National Committee for Quality Assurance, also known as NCQA, to measure performance on care and service delivery, including access to and availability of care, care for older adults, effectiveness of care, and utilization. Focus areas for these measures include, but are not limited to, measures on access to preventative care, follow-up after emergency room visits, and hospital readmission rates. The Medicare Health Outcomes Survey, or HOS, is a survey tool that is administered annually to a sample of enrollees from each Medicare Advantage contract. 2 years later, the same respondents are surveyed again, and the self-reported data is then used to measure physical and mental health outcomes over time. CMS administrative data is also used, pulling from a variety of sources. Administrative data sources include required Part C and Part D plan reporting, the CMS Complaints Tracking Module, also referred to as the CTM system, and the Medicare Beneficiary Database suite of systems. Data from CMS's contracted independent review entity and from health plan call centers are also used. Finally, pharmaceutical data and year-over-year improvement data are also used in the rating system, but they are not defined here. To assess Part C and Part D quality and performance, CMS groups measures of similar focus into discrete domains. There are 5 domains total in the star rating system for Part C plans and 4 domains for Part D plans, or PDPs, as you can see here. For Part C, the domains include staying healthy, managing chronic conditions, member experience with the health plan, member complaints and changes in plan performance, and plan customer service. For Part D, the domains include drug plan customer service, member complaints and changes in plan performance, member experience with the plan, and drug safety and accuracy of drug pricing. Next, we will review the measures that fall under each of the domain areas. So starting with Part C measures, these are listed in the table here and grouped together into the 5 domains we just reviewed. The domains are listed just above the table, and each set of domain-specific measures has been shaded a different color. The relevant data source for each measure is also included in the table. As an example, for staying healthy, the measures under this domain are shaded in green and listed at the top left of the table. These include 2 HEDIS measures examining the rate of cancer screenings, 1 annual flu vaccine measure derived from CAHPS data, and 1 measure focused on monitoring physical activity. As we discussed earlier, star ratings are generally assigned at the contract level, not the plan level. However, there were 3 Part C measures that are special needs plan, care management, and care for older adults measures that are reported at the plan benefit package level. Those can be seen here on the slide as well. These SNP-specific measures may be of particular relevance to states interested in assessing individual plan level performance of D-SNPs operating in their state. For Medicare Advantage plans with prescription drug coverage, Part D measures are grouped into 4 domains, which are listed here above the table of measures. Like the previous slide, you will see the measures are grouped into each domain, and each domain is shaded a unique color, and the data source used to calculate each measure is included. Pharmacy-related data is uniquely used to calculate Part D measures. Pharmacy data sources used by CMS include prescription drug event data, Medicare Plan Finder drug pricing files, and other required Part D plan reporting. To learn more about either Part C or Part D performance data, viewers can visit the CMS website listed directly under the Part D measure table. Now we will step back and take a broader look at the star rating framework, which includes reporting of plan performance at measure, domain, summary, and overall rating levels. At the measure level, each measure is reported in two ways. First, as a score, which is either a numeric value or can also be assigned as missing data if relevant. And second, as a star, which is the conversion of a measure's numeric value or score to a star rating. Measures are then grouped into domains, and domain level ratings are assigned. For Medicare Advantage prescription drug plans, including D-SNPs, the domains are grouped to calculate two summary level ratings, one for Part C and one for Part D. And finally, an overall star rating for each Medicare Advantage prescription drug plan contract is assigned. Each year, CMS issues technical notes that outline the specific methodology used for calculating star ratings at each of these levels. This includes details on whether CMS applies any weighting to the measures, and if applied, which measures will be assigned the highest weight. For example, when calculating a summary or overall rating, a measure with an assigned weight of 3 would count 3 times as much as a measure given a weight of 1. New measures included in the star ratings are generally given a weight of 1 in their first year of inclusion. As noted earlier, for 2024, a total of 42 measures are used and grouped into the Part C and Part D domains. It is important to note these measures can change year to year, and to the extent that Part C and Part D measures are duplicative of one another, only one instance of those measures is used in the calculation of the overall rating for a Medicare Advantage prescription drug plan contract. So what role do star ratings play in comparing Medicare Advantage plans? Star ratings are displayed on the Medicare Plan Finder, the online CMS tool available at CMS's Medicare.gov website. The Plan Finder can be used to compare plan options before potential enrollees or their caregivers make enrollment decisions. As individuals navigate the Plan Finder, the star ratings are displayed and can be examined at the overall, summary, domain, and measure levels. Star ratings are an important piece of information that can be used to assess the performance strengths and weaknesses of available Medicare Advantage plans, including D-SNPs. In addition to quality ratings, potential Medicare Advantage enrollees can use the Medicare Plan Finder to compare the coverage and costs associated with available plans in their area. Understanding whether an individual's current prescriptions will be covered by a plan, whether there are supplemental benefits that could be valuable to a prospective enrollee, or whether there are any out-of-pocket costs associated with enrollment are also important considerations for individuals when comparing Medicare Advantage plans. Now that we have a foundational understanding of the Medicare Advantage star rating system, let's review its importance to potential enrollees, Medicare Advantage organizations, and CMS. For potential Medicare Advantage enrollees, the rating system can be used to help compare plans, and depending upon a plan's ratings, potential enrollees may either be encouraged or deterred from enrolling in a plan. However, as noted earlier, there are other considerations that are important when deciding whether or not to enroll in a Medicare Advantage plan. This includes the sufficiency of a plan's provider network, in addition to coverage details and any out-of-pocket costs. Out-of-pocket costs are less of a consideration for Medicare beneficiaries that are also eligible for Medicaid, particularly for individuals that are eligible for full Medicaid benefits. For Medicare Advantage prescription drug plans, including D-SNPs, star ratings can impact plan payments, or the per member per month payment that CMS makes to a plan for each enrollee. For plans with ratings of 4 stars or above, current Medicare Advantage payment policy provides a 5% benchmark rate bonus to the plan. This quality bonus payment raises the Medicare fee-for-service benchmark that a plan has to bid against when applying to contract with CMS. The rating system also impacts plan payments by allowing Medicare Advantage organizations with higher ratings to retain a larger percentage of rebate dollars. Rebate dollars are used by plans to fund supplemental benefits, administrative costs, or plan margins. To learn more about Medicare Advantage payment and how star ratings impact plan payment, you can view the related training video in this series titled "What Medicaid Officials Need to Know About Medicare Advantage Payment Policy and Rate Setting." Medicare Advantage organizations may be impacted in other ways by star ratings. For organizations with consistently low star ratings, their ability to continue to contract with CMS can be impacted. CMS may terminate a contract when a plan fails to achieve a summary rating of at least 3 stars for 3 consecutive contract years. When a Medicare Advantage organization with a 5-star rating is available, these plans are designated as high performing on the Medicare Plan Finder. And once a year, a 5-star special enrollment period applies. Special enrollment periods permit enrollment into Medicare Advantage plans outside of typical enrollment periods. In this case, an enrollee can use the 5-star special enrollment period to switch to a plan with a 5-star quality rating once per calendar year. Conversely, CMS sends a once-a-year special enrollment period notification to individuals enrolled in low-performing plans, highlighting the enrollee's ability to switch to another plan. CMS also limits low-performing plans' ability to accept enrollments via the Medicare Plan Finder. For CMS, the rating system helps to fulfill its responsibility to measure the quality of health and drug services received by those enrolled in the Medicare Advantage program, and allows CMS to publicly rate plan performance. The underlying performance data is also important to CMS, given its role in monitoring the performance of all Medicare Advantage contractors, including D-SNPs. Now that we have a foundational understanding of the Medicare Advantage star rating system, let's review why this matters for states contracting with D-SNPs. First, states can use Medicare quality data from D-SNPs for oversight and monitoring purposes. Dependent upon state goals and capacity, this can include using publicly available performance data and ratings to understand the performance of a state's contracted D-SNPs, or it can also include requiring that D-SNPs submit Medicare quality data directly to the state to support Medicaid quality improvement or population health goals. Opportunities exist for states to examine whether plan performance varies for particular subpopulations of D-SNP enrollees, including those who are more likely to be impacted by health inequities. States can partner with DSNPs to learn more about Medicare quality data and opportunities to further their quality-related objectives. Second, states can partner with entities like their state health insurance assistance programs to help potential enrollees understand the star ratings and how the ratings can be used to inform enrollment decisions. Third, it is important for states to understand how the Medicare Advantage organizations that it contracts with are performing. This can be particularly important when states choose to contract selectively with DSNPs. States need to be aware of the potential actions that CMS may take against a consistently low-performing plan, which may include contract termination. If taken, this type of CMS action can have direct implication for states that competitively procure Medicaid managed care plans and selectively contract with DSNPs. States can use their contracting authority with DSNPs to require timely notifications of any potential CMS actions that could impact the state's contracting strategy. Now we will cover some key takeaways and available resources in the final segment of our training. Some of the key takeaways to keep in mind from today's content include: 1, star ratings can help potential enrollees and their caregivers compare options and make informed decisions before enrolling in a Medicare Advantage plan. 2, star ratings can impact the dollars Medicare Advantage organizations have available to fund supplemental benefits and/or reduce cost sharing when applicable. States can work with DSNPs operating in their state to understand how star ratings may be impacting the rebate dollars that plans have available. 3, a Medicare Advantage organization with consistently low performance in the star rating system can have their contract terminated by CMS. This can in turn directly impact a state's DSNP contracting strategy. And 4, states can partner with DSNPs to collect and use Medicare Advantage quality data to understand plan performance and advance related Medicaid program goals. Finally, it's helpful to point out that the ability of a state or their contracted DSNP to take advantage of the policy or program design opportunities covered in this training can vary by state. This is because there is a relatively wide range of state landscapes and levels of integration that states may pursue. Additionally, the Medicare Advantage marketplace varies across both states and counties, and it can be impacted by Medicare payment policy, competitive dynamics, enrollee preferences, the provider landscape, and other factors. Medicaid officials overseeing DSNP contracts should therefore work closely with health plan partners to develop policies that align with their individual state landscape and goals. There are a number of resources available to states working to integrate care for dually eligible individuals. States can visit the Integrated Care Resource Center at integratedcareresourcecenter.com to sign up for e-alerts and access a wide array of materials developed specifically for state officials working to improve care for dually eligible individuals. States can request free technical assistance through the Integrated Care Resource Center by emailing icrc@chcs.org. States can also contact the CMS Medicare Medicaid Coordination Office to learn more or develop new or refined policies in this and other areas. You can learn more at the CMS website listed on the slide. And finally, states can also work with the DSNPs operating in their state to learn more about this topic area and consider development of related policies. Today's training offered foundational information on the Medicare Advantage Star Rating System. You can view additional training modules in the Medicare Advantage Policy Basics video series to build on today's content and learn more about the following topics: Medicare Advantage contracting and bid development, Medicare Advantage payment policy and rate setting, and Medicare Advantage supplemental benefits. Thank you for viewing this video about the Medicare Advantage Star Rating System, part of CHCS's Medicare Advantage Policy Basics video series. This video series was produced through CHCS's Medicare Academy, an initiative made possible by Arnold Ventures, the Commonwealth Fund, and the SCAN Foundation. To learn more, view additional videos, and access resources to support integrated care, visit the CHCS website listed on this slide.